So you're probably here because you recently got a cut or a scrape, an abrasion somewhere. Abrasion is a pretty complicated terminology for scrape on your skin. And you're wondering, how are you going to treat the abrasion or cut? My name is Cassie, and I've been a registered nurse for approximately about 12 years. I've always practiced in the hospital. Prior to me being a registered nurse, I was a nurse assistant. So it's been about approximately 13 years that I've been in the healthcare sector. About 6 months ago, I graduated with my nurse practitioner license. So I've done tons of study in the healthcare field. Even while I was in nursing school and in my nurse practitioner program, I've always been incredibly interested in the Eastern medicine, or in other words, like complementary alternative therapies. So now that I've graduated and I have a bit more time on my hands, I'm actually wanting to dive deep into these types of practices. And I'm hoping that you'll follow me on this journey to see if some of these new treatments are effective. So if we can talk about what I would typically do for a patient in the hospital when they get a cut or a scrape somewhere, usually we would use normal saline solution, which is 0.9% of sodium in water. We will clean the wound with normal saline solution by applying it to a gauze pad, which is in other words like a cotton ball. We would wipe the wound or just gently apply some directly to the wound. Once it's clean and dried, we would just cover the wound with a dressing. Now, if the wound has become infected or it looks too deep, we would implement other strategies. But today I just want to focus on what would be done if there was just a cut, a surface cut, or an abrasion. So I did some additional research online just to see if I typed into Google exactly what the internet would be recommending. According to Mayo Clinic, they recommend that we put antibiotic or petroleum jelly on the wound to cover it. Similarly, the Cleveland Clinic, they also recommend for us to put some antibiotic ointment and to cover the wound to prevent an infection. WebMD just recommends for you to clean the wound with water and to never apply hydrogen peroxide, alcohol, or iodine, because apparently that can slow down the wound healing process. So an all-natural complementary and alternative practice that I've always been interested in are essential oils. According to research, essential oils are great. So let me just give you a little bit of background on lavender essential oil. Lavender essential oil actually originates from the Mediterranean. You can actually find this plant here in the United States. You can find it in Australia. You can find it in Europe. This plant requires a lot of sun to thrive. The plant is fairly small. It's a shrub and it grows approximately about 2 feet. The way that lavender essential oil is made is it's through a process called distillation. A summary of how distillation works is you put the lavender flower, the main essential part of where the lavender oil comes from, into some water. Then you boil the water, and after boiling the water, they have this large contraption, and the steam that rises from the boiling water that is carrying the oil from the plant, it becomes collected. So if you're looking for pure lavender essential oil, this is typically how you would get the purest form of lavender essential oil. I was wondering, what is the actual credibility behind lavender essential oil? There must be some studies, some evidence-based articles, because, I'm in school and we write tons of articles that have to be evidence-based, meaning they've done research on it in their own experiments, we would say. So there was one study, they actually tracked the application of lavender essential oil on a wound, and they compared it with a wound that was not using lavender essential oil. And through its investigation, they found that lavender essential oil actually speeds up the wound healing process. In another study, there was 120 women who received an episiotomy. What is an episiotomy? All my women out there who've been pregnant before, you potentially had an episiotomy. For those of you who don't know, there's a cut that's made between your anus and your vagina. So right in between, there's perineum. The doctor will sometimes have to cut the perineum in order for the baby to easily come out of the vaginal canal. They've done a study on 120 women, and by applying some lavender essential oil on top of that cut, these women actually experience better healing time, less inflammation, and also less swelling. Another study that was a little bit more recent did the same experiment with women who had an episiotomy, and just like the first experiment, they had less swelling, less redness, and less discomfort, in other words. So I think overall, I found that lavender essential oil can be fairly beneficial if you happen to get a cut or an abrasion, in comparison to what they would be recommending online, which is an antibiotic or something of that sort, because I'm sure you guys have heard of antibiotic resistance. And I mean, that's a whole nother topic. And that brought me to my next thought. Since the internet is recommending to use topical antibiotic, I just wanted to do a quick research. And according to the National Institutes of Health, lavender essential oil it's actually an antibacterial, it's an antifungal, it's an antioxidant, it's an anxiolytic. I forgot what that word means. It's an anticonvulsant, and it's an anticholinesterase. It has the same similar properties to these medications that are manufactured by these large companies. So I think that you could use this lavender essential oil in a similar way. So how would you actually apply this lavender essential oil? The recommendations that I'm seeing online, definitely when you get a cut or a scrape, make sure you wash the wound. It would have to be a very superficial scrape or a wound, nothing deep where you can actually see your muscle or your bone. In that case, you're probably bleeding profusely and you need to take yourself to an urgent care or a hospital because you have a larger cut that's deeper that potentially may need to be stitched. You may be losing more blood and you may need further treatment. So if you get a superficial wound, again, you wash the wound with some water. It should be good enough. And you can get a cotton ball, apply a little bit of lavender essential oil, and then just dab it onto your wound or your cut. Then cover it with a Band-Aid. Now, research has also shown that if you use lavender essential oil, it will improve the healing time of the cut, and it will also help with the improvement of a scar that may form from the cuts. In other words, it will speed up the healing time of the wound, and then it will fade the scar much faster. But if you're not into lavender essential oil and you think this is all phony and it may not work, you can go ahead and check out all of the articles that I have posted down below. They are all reputable sources. It can be a little bit complicated because there's a lot of jargon in the scientific research studies. Or if you want to just stick to what Google has to offer, you can go to a CVS or a Target, and you could potentially pick up what I found here is some Rapid Seal Wound Gel. This is an antibacterial. Let's see what this consists of. So it says here it's for minor cuts and scrapes. It stops bleeding and it seals the wound. And apparently it's non-irritating. This little jar, which is about 8 mLs, they're recommending a total price of $10.29. Now I'm wondering what this medication is made of. So I want to go to the ingredients. But where is the ingredients? Okay, here it is. Water, palmitoyl, chistosan, ethanol, again, chitosan. Why do they have it twice in the ingredients? Oh, the first time is palmitoyl chistosan, and then the second time is just chistosan. I don't know if I'm actually pronouncing it correctly. And then the third, or it also has L-lactic acid and tetrasodium. I personally don't want to do the research, but you can go ahead and do the research yourself and see what it gives you. Okay, or you can go to CVS again and pick up what they have here. It's called New Skin Liquid Bandage All-in-One Protection Brush. I mean, it has a pretty good rating. It's a 5 out of 5 out of 27 reviews. And let's see what this consists of. Okay, here we go with my pronunciation. The first ingredient you have is benzethonium. You have amyl acetate, butyl acetate, camphor, ethyl acetate, nitrocellulose, SD alcohol 3C. Wow, that list is pretty extensive. Or you can pick up a bottle of lavender essential oil. Let's see, lavender essential oil. So the lavender essential oil that I have in my cubby, it's by Handcraft. I looked for it on Amazon, and I typically go for products with high reviews. So this product has 95,000 reviews, approximately. Oh, it's almost hitting 96,000. And it's rated a 4.5. So it's a Handcraft Blends lavender essential oil. It's 100% pure and natural. I'm sold. So let's go to the ingredients here. And look, the only ingredient that you have is lavender essential oil. Now, with applying any new product to your skin or ingesting it, you always want to test it out before you use it. So just apply a little bit to your skin, see how your skin reacts to the product. And if you start to get like a little bit of redness or is itching or burning, or maybe you're just allergic to that product and you can't use the lavender essential oil at all, or maybe you just need to find a new product that is manufactured differently. Well, I hope you enjoyed my presentation today. Again, follow me in my new journey to complementary and alternative medicines. It's not that I haven't been using it in several years that I've been practicing Western medicine in the US healthcare system, but I think that these therapies should be given as much attention as the Western medication or treatment plans. Thank you. Bye.